Welcome. Thank you for attending the 2020 Behavioral Health Symposium. We are happy to host this event as a virtual conference because we care about your health and safety. But we also understand how important it is to provide relevant and robust continuing education to Louisiana healthcare professionals. For quality purposes, all participants will be muted during the presentation. Please note that this presentation, the welcoming remarks, is not accredited for any CEUs. Full participation is required. And financial disclosures. None of our speakers have any financial disclosures. None of the members of the symposium's planning committee or any session moderators have any financial disclosures. Now that we have those general housekeeping notes out of the way, again, good morning to everyone. My name is Charlene Gradney. I'm a program manager with the Louisiana Office of Behavioral Health. My colleagues on the Symposium Planning Committee and I are so excited to be here today to welcome you all to the Behavioral Health Symposium, Changing the Conversation in 2020, Recovering, Rebuilding, Rejoicing. We began planning the symposium in November 2019, as our journey along the way has changed courses many times. As Louisiana had its first confirmed positive coronavirus case in March 2020, and the entire state was impacted, we developed an agenda focused on overall behavioral health and our responses to trauma, loss, and our new norm. Our path was later changed with the need to transition the Behavioral Health Symposium to 100% virtual. Within days before going live with our event, our great state and our great people were hit by the devastation of the most destructive of hurricanes, Hurricane Laura. The great people of Louisiana were hit by yet another disaster. Our hearts are with everyone during these challenging times. When we changed course with the topics for the symposium earlier this year, our mission became to provide useful tools, resources, and practices to help everyone with the behavioral health response to the coronavirus. Whether it be providing useful methods to respond to trauma through mindfulness, how to help our kids who are returning to school in a new norm, how to engage with those we serve through a smartphone, or how to support each other in self-care. While our lives in Louisiana were again hit with a major blow just days ago by Hurricane Laura, our goal remains the same: to provide useful practices, tools, and resources and thoughtful discussions to support you all with not only taking charge of our physical health, but also our behavioral health during these stressful times. Over the next 2 days, we hope we all have the opportunity to learn something new and useful to care for ourselves and others. We hope you meet new people virtually through the Behavioral Health Symposium app and online community board. And we hope you find some joy in hearing everyone's presentations and stories. We encourage you all to join us for the virtual lunchtime showcase at 12:45 today, where some of our wonderful sponsors will present useful information, and you will have the opportunity to win some virtual door prizes. As we have shared, this has been a journey filled with many twists and unexpected obstacles to organize the 2020 Behavioral Health Symposium. While it has been an unexpected journey, it has been a journey filled with passion and determination from the Symposium Planning Committee and the leadership within the Louisiana Department of Health. As the circumstances of the people of our great state continue to change, our plans for the committee and for the symposium continues the same, with hopes that this symposium will meet the needs of all of you, as we have over 950 people registered to participate in the symposium over the next 2 days. This morning, you will hear from some of our great leaders, including Ms. Karen Stubbs, our Assistant Secretary with the Louisiana Office of Behavioral Health, who has supported the symposium in every change along the way. We will also hear from Dr. Courtney Phillips, Secretary of the Louisiana Department of Health, who we are grateful is able to join us briefly this morning, as we know her schedule is more than packed with leading the department's efforts to respond to coronavirus and Hurricane Laura. Governor John Bell Edwards intended to provide live welcoming remarks this morning. However, as you can imagine, his schedule has become quite unpredictable in response to Hurricane Laura. Therefore, he sent a heartfelt welcome to all of our participants, which we will show later this morning by video. Thank you to all of our leaders for your leadership and commitment to supporting behavioral health services and resources for the people of Louisiana, as we all work together to change the conversation, recovering, rebuilding, and rejoicing. It is my great pleasure to introduce our Assistant Secretary for the Office of Behavioral Health, Ms. Karen Stubbs. Prior to being appointed the Assistant Secretary for the Office of Behavioral Health, Ms. Stubbs was the Deputy Assistant Secretary of our office and led our office's implementation of behavioral health managed care, creating the section for health plan management. Prior to coming to the Louisiana Department of Health, Ms. Stubbs worked with the Office of Juvenile Justice and was the Executive Director of the Children's Cabinet in the Governor's Office. She is an attorney who graduated from LSU's Paul M. Hebert Law Center following completion of her finance degree from Tulane University. Please join me in giving Ms. Karen Stubbs a great virtual welcome. Thank you all again.
Thank you, Charlene, and thank you and the planning team for being so flexible. The number of times that we've had to change plans has been really unprecedented, to use a word that's become pretty common. Changing the conversations in 2020, I don't think anyone ever realized how different the conversation would be this year. And 2020, we are literally recovering, rebuilding, and we will be rejoicing before the end of the year. But along with all the state changes the state has experienced, the Louisiana Department of Health also experienced a pretty exciting change with the welcoming of our new secretary, Dr. Courtney Phillips. Dr. Phillips, as the Secretary of the Louisiana Department of Health, which is the state's largest agency, has the oversight responsibilities that include public health and other direct service programs for citizens, such as behavioral health, developmental disabilities, adult and aging services, emergency preparedness, and the Medicaid program. So she's definitely not busy at all. Dr. Phillips, before coming to Louisiana in this role, served as Executive Commissioner of the Texas Health and Human Service, where she was committed to improving health, safety, and well-being for millions of Texans. She was responsible for more than 40,000 team members and more than 220 programs ranging from healthcare, food safety and benefits to public tracking and regulation of childcare, nursing, and healthcare facilities. Before joining Texas Health and Human Services, Dr. Phillips served for 3 years as the Chief Executive Officer of the Nebraska Department of Health and Human Services. Before that, she spent 12 years here with us at the Louisiana Department of Health in a variety of roles. And to that we say, welcome home, Dr. Phillips. On a personal note, I would like to share, I think this is really representative of Dr. Phillips and what I've seen of her leadership style. In the very first conversation her and I had after her returning to Louisiana, and we hadn't seen each other in years, she started with, so Karen, how are you doing? And I immediately responded with, well, OBH is doing this, and our staff and our priorities. And she goes, and she interrupts me in very much the Dr. Phillips way and said, no, Karen, I asked you how you were doing. How are you? How is your family? Personally, how are you doing? And I smiled, I was taken off guard, and quite honestly, I didn't know how to answer, because we are so often professionally not asked about how we are as people in our personal lives. And so I will carry that moment with me and share it, because I think it is very representative of how she plans to lead the Department of Health. So with that, I will turn it over to Dr. Phillips to give some welcoming remarks.
Thank you, Karen. Good morning, everyone. And thank you all for inviting me to give these remarks in such a challenging time in our state. And before I jump in, I do want to thank the LDH team members for putting this on. And as you mentioned, just the adjustments that are needed to be able to put something on with so many different things that are happening in our state today. It's so important for everyone who's attending, just their dedication to behavioral health in this time and their commitment. And that's evident by everyone who's attending the symposium, with the coronavirus, with the hurricanes and our response efforts. And just doing this in a digital manner is just a challenge, but I appreciate their commitment. I hope soon we're once again able to hold these in person in light of the pandemic when we are able to get to that stance. I'd also like to acknowledge our sponsors and our partners for this event: Louisiana Healthcare Connections, Aetna, Tulane's University, Louisiana State Opioid Response Grant, Acadian Area Human Service District, and the Women's Foundation. As Karen mentioned, I returned here about 4 months ago, and I'm extremely proud to be here at the Louisiana Department of Health. I feel like it's where I was raised, it's home for me, and I'm just appreciative to be able to lead this organization, particularly during this time. The last week has been challenging for everyone here, extremely in terms of the Gulf Coast area and the devastating hurricane that's impacted our state. But as challenging as it's been, I've been proud to see the team members so dedicated in working to this effort, not just in their normal working environment in the normal areas, but just the dedication of our team members saying, how can we help? What do we need and what do others need? Regardless of what their normal job function is, how can we pull together to help serve? And at the crux of our organization and who we are as individuals and what we bring to Team LDH is service to others. And that's so important in a day-to-day operation, but critically important as we face coronavirus and hurricane season. We've always prioritized how we learn from disasters. Many of us were here during Hurricane Katrina and learned from that experience. But we also learned from other exceptional weather events like the Baton Rouge floods. And I wasn't here for that on the ground, but talked to many of you all in terms of what was happening and what was the response. Laura will certainly go down as one of the strongest storms to ever hit the Gulf Coast. As we speak now, we know we have more than 10,000 evacuees in our state, with 9,000 of them being in hotel rooms across the state, majority of them in New Orleans. We also know that we have about 4,000 evacuees officially in the state of Texas. The unofficial number from what we're hearing from our counterparts is about 8,000 to 9,000 in Texas that we're constantly working with them on. As the storm struck, we were already struggling and coping with the new normal of COVID. In the area of the state that was among most concerning for our virus infection rate and our positivity rate. This is clearly an extraordinary year, but on both fronts, the department has planned extensively and has acted decisively, and I am extremely proud of our team members. As soon as we knew how contagious coronavirus is, we began planning and pulling back in terms of congregate shelters and tried to move forward with the plan of putting evacuees in hotel rooms to try to decrease the spread. We had to shut down community testing in terms of COVID in our sites, but many of those are back up and running, thankful to our laying partners, the National Guard, who are on the ground, who couldn't be better partners. We're extremely appreciative of them. We also know that we have many team members across the department, including the Office of Behavioral Health and our governing entities across the state. The LGEs have been remarkable in their response and assistance to both coronavirus as well as to the response for Hurricane Laura. And I'm appreciative. There have been nights that I have called and I've asked them to send team members to hotels, to some of the shelters, to the wraparound sites, and without hesitation, they have responded in less than an hour. And so I'm extremely appreciative for that response and being able to roll up our sleeves and work together. As we continue to move forward and look at where we're headed as a state, and people evaluate the damage of their homes and the recognition that they may not be going back anytime soon. Many still don't have electricity, many still don't have water. And our teams are on the ground doing those assessments, trying to figure out what we can do to expedite that situation. We know that all those pressures put a steep toll on mental health. Access to medications can be disruptive. Our team have set up pharmacy sites on the ground, but still the sense of hopelessness can be pervasive. Substance use abuse can become a problem, but the department teams continue to work around the clock on their response, including behavioral health, and some of our darkest days that we will see. One of the great things of being home is knowing the team that you're working with and the dedication and commitment that they have around behavioral health, not just where we are today, but pushing forward in terms of advancing and promoting the positive practices. And so Karen, I'm appreciative of your leadership and always pushing us to try harder in the last few months. And Karen was right. In terms of when we first met, she immediately started of all the things she wants to do in behavioral health and where we're headed. And we did have that conversation. I'm excited in terms of the direction she's taking the agency and pushing us as a state in terms of moving forward of what our needs are and being able to service others. And while we've been extremely focused on public health in terms of the pandemic, we do know that the importance of behavioral health around that and the critical element of the response to those in need. We saw it in coronavirus, we continue to see it, and we see it as it relates to Hurricane Laura. It's a natural feeling of anxiety, grief, worry. We all feel it, those who have been impacted directly or indirectly. I know I feel it on a day-to-day basis in terms of making sure our team members are taken care of so they can take care of others. Sometimes we forget because we're so busy taking care of others, we forget to take care of ourselves and the ability of what we will need to provide for others in a long-term manner. This won't be solved overnight, and so we have to pace ourselves and make sure we have the right support for our team members and others to go forward. So making sure that getting help is critical in order to help the individual, their family, and the communities to successfully recover. And again, it's not just evacuees or storm-related residents who will struggle. We know from our COVID-19 response that caring for others during the long-term disasters can take an emotional toll. It's the case for healthcare workers, first responders, and the frontline workers caring for everyone. Many of the heroes have spent untold amounts of time away from their family, serving their communities. With Laura, that will be true as well. It's a stressful time for them. It's a stressful time for all of us. So we have to acknowledge that. We have to talk about it during the stress. Some may make unhealthy choices. This may have negative coping and emotional reactive behaviors. Depression may worsen, and the anxieties of finding the day-to-day basics, such as food, water, and shelter, put a tremendous amount of stress for people. And so we have to figure out, and our team has moved extremely quick pace to set up resource centers, set up call lines to make sure that we can service others. Our team at the Division of Behavioral Health set up the Keep Calm hotline and immediately didn't just use that for COVID, but also looked at how can we use that for individuals calling in who have been impacted by Hurricane Laura. The line offers recovery support 24/7 every day of the year to work with individuals with substance use, mental health, or co-occurring disorders. It's also focused on providing assistance to individuals in the healthcare field. And so please help us to promote the lines for individuals to get the access to services that they need. On the ground, the department has also provided on-site and virtual behavioral health to COVID-19 isolation sites that offer some emotional support and stress management. Again, not just for COVID, but our team has been on the ground immediately as a response for Hurricane Laura. We also are looking at in terms of several federal award grants that help to support our COVID-19 efforts. Our team has been in constant contact with our federal partners in terms of what the needs are for the state, not just for COVID-19, but also as it relates to Laura and how can we expand the services that we have in the state. And so again, I'm extremely appreciative of the response that I've seen, not just from the department, our department, the Office of Behavioral Health, our local governing entities, but also all individuals who are part of the behavioral health system. We at LDH could not do it without you. You have been there, you continue to be there when we call and we ask, and many times you're there even before we call and we ask. And so sitting in this seat, I must tell you, I'm extremely appreciative and thankful to have you as our partners as we go through this. It's gonna be a long ride, but we will be there together working with it. So I appreciate you all still putting this on, Karen. I know it was a trying time to try to put this on, but I think it's important that we continue to have this conversation, continue to our efforts, and looking at the changing conversation in 2020. This is a part of it. COVID, Hurricane Laura, and anything else that's thrown our way. 2020 will be one for the books, but the state of Louisiana will come on top. And so again, I'm appreciative for your leadership in your area and for everyone that's been a partner for us in the last several months. I'm gonna introduce the governor's video, if you guys have it queued up. And so the governor doesn't need any introduction, but just a little bit in terms of his efforts and me working with him for the past almost 5 extraordinary months that I've been here. As you all know, he's the son of a sheriff and a charity hospital nurse. His family ingrained in him the importance of serving others and the compassion for the sick and less fortunate. And I think we see this on a day-to-day basis, that the governor always puts Louisianians first. His commitment of giving every Louisiana access to health care was evident in his first official act as he expanded Medicaid. And that decision has greatly helped us across our state in terms of healthcare access, including behavioral health services. And I don't think we would be in the position we are and able to respond to our COVID efforts or to these current hurricanes, and without his steady hand in managing emergencies. So it's my great pleasure and honor to introduce via video our governor, Governor John Bel Edwards. So again, thank y'all for the opportunity, Karen.
Hello, everyone, and welcome to the 2020 Behavioral Health Symposium. Louisiana's behavioral health care workers are on the front lines of some of our most challenging times, and I can't thank you enough for the work that you're doing. Almost everyone has either personally been affected by mental illness or knows a loved one who has. You have extremely difficult jobs, no matter the circumstances, but COVID-19 and now Hurricane Laura have caused additional stress for thousands more people. Anyone struggling during these difficult times deserves the understanding, love, and support that you provide. This year's theme is Changing the Conversation. I know that topic was originally intended to be about the challenges of responding to COVID, but Hurricane Laura has made your work even more important. Please know how much I appreciate the vital support you are providing. Louisianans are strong, but no one should feel ashamed about asking for help. Thank you again, and God bless.
Thank you. Thank you, Dr. Phillips. Thank you, Governor Edwards. We appreciate those words. And I'm here to assure everyone, the 950 participants who likely have some connection to the behavioral health field, I'm here to assure you that behavioral health is in the front of everyone's mind in all of the responses, the Hurricane Laura response, as well as the COVID response, and has been from the beginning. We've been supported and enabled to act quickly, to basically, from the department, the Office of Behavioral Health's perspective, to be able to say this is what we think is needed and have full support and resources to implement. And in a way that I've just never seen before. So I really appreciate the importance that's been placed on behavioral health. So for the next few minutes, I'm going to talk a little bit about the agenda over the next 2 days, as well as some response activities from the department, from the Office of Behavioral Health. So if you've spent some time studying the agenda, you can see that it was very thoughtfully laid out. It was kind of adjusted several times, but the theme throughout is responding to the trauma. At first, it was very specific to COVID, but now we can see that several of these really have dual roles, dual meanings, and respond to both Hurricane Laura and the COVID response. A few things that the Office of Behavioral Health immediately went into in March and April, and there are things that I think are really lessons learned and responses that we can now take with us in future responses. And I'm going to touch on a few things. A lot of these, it's kind of a teaser for different sessions throughout the next 2 days that you might want to tune into. But I'm going to talk a little bit about one of our initial responses, and it's something we've never really focused on before in a disaster, our telehealth allowances and other flexibilities that we immediately went into around specialized behavioral health services. I'm going to also talk a little bit about OBH's emergency response activities, and then I will hand off to Dr. Ashley Jefferson, who is my Chief of Staff and Sounding Board for the Office of Behavioral Health, who will talk about resources. And these resources have been touched on multiple times, but that's because they are extremely important. So if you're going to take a break and you're trying to decide whether you should take your break right now while I'm speaking or during Dr. Jefferson, I would say go right now, because the resources she's going to talk about are open to all Louisiana residents and are really important, and we're very proud of. But first, I want to talk to one of the initial activities we did when we, in March, when we went to COVID and the stay-at-home order and realized that our entire way of doing business was changing, was immediately looking at, we can't disconnect people from services. We can't disconnect them from their providers. And even more people are likely to need a behavioral health type of service. And so we looked at telehealth allowances. Within the Medicaid program, there were telehealth allowances already for certain LMHPs, licensed mental health professionals. They were never widely used. So the first thing we went to is, okay, it already exists. How can we push that out and stress that? What has been the barrier so far? And how can we relieve some of that so people can quickly keep in contact with a vulnerable population? Right after we did that, we looked at, okay, where do we need to go now with provider types that have never been able to practice in telehealth? And immediately looked at substance use disorder services. If you were able to tune in to the pre-conference yesterday on the opioid response, it was pretty amazing. And I'll give another shout out to Nell from OPH, who presented data on the increase in drug use and overdoses during COVID. We've all seen the national headlines talking about the increase in overdoses, but it wasn't until yesterday when the department unveiled the most recent data around overdoses and drug use that also proved, no longer anecdotally, but with data, that Louisiana is experiencing the same exact things. The numbers were staggering, and it was an amazing session. And then after looking at telehealth allowances for SUD, for substance use disorder, we looked at other behavioral health services like mental health rehabilitation providers and the services they provide. Tomorrow, I believe, is the telehealth session given by Robin McDermott and Candace Grace, which will be really interesting. They'll look into a little bit of data and the ins and outs of how to utilize telehealth. And so I would encourage you to listen to that if it's something that interests you in your practice, if you're a provider. The department also immediately went into other guidance in a detailed way that we've never done before. Things like being very descriptive about how to bill, because we realized that providers would be billing for things that they had never billed before. And of course that happens before, but never in this kind of pressure cooker with what might be fewer staff or in a remote way. So we knew that we needed to immediately get information out on how to do it quickly and easily. We gave very detailed information about okay, you're practicing differently. So what do we need to see in supervision and progress notes and signatures and documentation, and really went into a lot of detail there. So that's something we were pretty proud of. We were able to be really agile and quickly move and get that out, and likely really allowed members or people receiving services to stay connected with their providers with very little blip. So that's a little teaser for that session. I'm going to talk a little bit about our methadone clinics, our OTP, opioid treatment programs. We've got 10 across the state. They're sole source providers, so there's one in every region, with an exception of New Orleans. And so they were very important during COVID. It's also, with Hurricane Laura, also been a really kind of heightened topic that we've paid attention to. So we immediately went into some allowances with our OTP programs in accordance with federal guidelines. We were fortunate in that on a federal level, they also immediately kind of reminded people of certain flexibilities and made some allowances for additional flexibilities when it came to COVID, doing things like relaxing our methadone registry to allow different OTPs to service people who've evacuated because of Hurricane Laura. So people can continue with that treatment, because that's really been the name of the game, is continuing with treatment, making sure that access to care exists. For those of you who aren't familiar with our CSOC program, our Coordinated System of Care, it's a Medicaid waiver program for youth ages 5 to 20. We immediately looked at children who we all know, and there are several really great sessions over the next 2 days about children specifically as it relates to trauma and treatment of adolescents. with anxiety related to COVID. There's a couple that I personally am looking forward to watching. But for our CSOC waiver, we went into some allowances allowing them to maintain contact with their provider or their wraparound agency through telecontact, doing several things through verbal allowances, looking at trainings, looking at maybe not discharging as many people, looking at plans of care and when do they expire and how do we kind of address that. And then of course, keeping in touch with the actual participants, making sure that the providers and the wraparound agencies maintain that connection, which is so important during COVID, with the family members they serve, following them, looking at their needs, tracking who may be sick, who needs additional supports and what they can do. So we were pretty proud of that, and that program operated through Magellan. The Office of Behavioral Health, like so many other people, almost everyone around the state, had to also shift the way we do business and make sure, as Dr. Phillips pointed out, that we're taking care of our own staff. So I consider ourselves really fortunate because we're an office of behavioral health professionals who clearly prioritize mental health, mental stability, communication and sharing and checking on one another. So we implemented quite a few what I kind of think of as models of staying connected to our staff with daily emails and challenges and increased contact through all staff meetings and direct check-ins through emails and mandated communication on a daily basis with supervisors and things like that. I say often that for us to be able to take care of the rest of the state, we have to take care of each other first. And so making that a priority, which I'm quite proud of. And also proud that we never missed a beat. We were able to immediately shift to telework for 100% of our employees without missing a day. And so very proud of that. The Office of Behavioral Health staff, when everybody else was switching to stay at home, about a third of our staff, about 30%, we actually sent out into the field. So that was, it was scary. It was a big task, but that's where we were needed. And as state employees, that's the pledge we take when we're hired. And so we, as Dr. Phillips mentioned, we've been staffing emergency command centers since March. We've been out in the hotels that have been set up to house the homeless population during COVID. We've been out in evacuee hotels across the state recently. We've been out in the camps and the convention center that have housed COVID positive or potential COVID positive patients to make sure that both the workers and the people residing there have the emotional supports that they need. And of course, we do this hand in hand with our local governing entities, also known as human service districts and authorities, that have stepped up like I've never seen before. They always have, but it's kind of like this was just a prime opportunity for them to shine, and they really did. Also sending their staff out into the field, helping each other, crossing regions. I've also seen it once again repeat itself with Hurricane Laura, where they come together, they offer to share space, they offer to house and share pharmacy services. They're personally checking on each other and offering resources to each other's staff. And this was particularly important because, as we know, with Hurricane Laura, we have 64 parishes. I think at one point 42 of the parishes in Louisiana were under closures and power outages and had been affected by the storm. Those that weren't were affected in the way that they were housing thousands and thousands of evacuees and preparing for that. So everyone across the state has done their part. For those LGE staff that are watching, I just want to send a special thank you to you, and we're thinking of you because we know you've all been affected. We also were able to obtain a few grants from SAMHSA and or FEMA during COVID. one of them being the crisis counseling program. This has been branded as Louisiana Spirit. That's what we all know it as in Louisiana. And so that happens when an emergency declaration is, a presidential declaration is issued, and we're able to hire crisis counselors to get out in the community. But in COVID, we weren't getting out in the community, so everyone had to be very creative, and that's starting to loosen up just a little bit. But to get out and speak with people, talk to them about kind of how they're feeling, the stressors that just the world right now is triggering, and help people de-escalate, calm down, have a listening ear, and refer to more intense services if needed. So we're very proud about that. We have created also a few resources of information and hotlines available to everyone. And Dr. Jefferson will talk about that. We have several hotlines, and we're very proud of them. I'd like to just take a second as I wrap up to go through some of the agenda for the next 2 days, and then I'll hand off to Dr. Jefferson. And as we've been doing, if you tuned in to the pre-conferences yesterday, we are in a room and we are very physically distanced. And so because of that, I was a facilitator yesterday. The transition between speakers takes a little bit longer. We try to wipe down mics, give fresh mics, not touch each other's laptops, and one person walk away before the next person walks in. And so I would ask that you just bear with us as we transition throughout speakers. But a little bit about today's agenda and tomorrow. One of the other topics that really COVID has highlighted are health disparities. And so I'm very excited that we have Dr. Benjamin who's going to speak around that. Mindfulness and mind-body medicine. So this is something that we've talked a lot about within the Office of Behavioral Health, also with our first responders and healthcare professionals, and the toll it takes emotionally and then therefore physically, and really needing to refresh, spend time to take care of yourself, try to combat that compassion fatigue that we hear of. So I think that's going to be a really great session. We also have sessions on child sex trafficking, treatment of adolescents with anxiety related to COVID. I think that's going to be really great for people, not just professionally, but personally as a mother of young children who are really having a hard time adjusting right now. A lot about trauma, and so transforming trauma. We had a pre-conference session yesterday around the opioid response. And so you see that theme carried through with a few of these. And the one question we got yesterday was around prevention activities. And so I highlighted the session on non-opioid alternatives to pain management as one of the areas of prevention. So I look forward to that one as well. Some really interesting topics around addiction, substance use, and recovery during COVID that also feeds off of a lot of the information we had yesterday around the increased numbers of drug utilization and overdoses. On Thursday, tomorrow, some really important sessions around having a suicide-aware vocabulary. It's even more important right now when we see kind of the need to be responsive and aware of people's mental health. We'll have the telehealth utilization session that I referenced, getting housed, getting safe. And so that's a session around homelessness, especially in the COVID era. Want to point out a session on peer support services. We also quickly touched on this yesterday and how important that is. It's one of the priorities of the Office of Behavioral Health right now. ACEs, we have a session on adverse childhood experiences, which is always a great session, regardless of COVID or Hurricane Laura, but you hear a lot about adverse childhood experiences. one of the sessions I really want to highlight, make sure people are aware of, is grief and loss. I know just within our office, the Office of Behavioral Health, the volume of loss that our team has experienced is unreal. We've had specific bereavements and grief and loss sessions because of the volume of loss, and I don't think we're unique to Louisiana or the country right now. I think everyone is experiencing that. So I highly encourage people to attend that session. And more trauma related sessions, also self-care, very important, and a session about first responders, frontline workers, and the military, also something that we're hearing a lot about. We're going to continue to hear a lot about, because the effects of how they're responding and what they're responding to, especially in New Orleans with emergency on top of emergency, will be really important. So with that, I hope I piqued your interest and excitement over the next 2 days. Maybe you didn't have a chance to look through the entire agenda on your own. So now you'll be even more interested to make sure that you carve out time from your next 2 days to listen to some of these sessions. So with that, I am going to remask, step away, and ask Dr. Jefferson to come up and share some resources. Most of these resources, I'm sure she'll point out, are on our website. So if you don't have a chance to write it down as she's presenting, she will let you know where to find them. So thank you, Dr. Jefferson.
Good morning, everyone. Thank you to Ms. Stubbs and to the hosts and the planning committee. I just wanted to say a couple of things about some of the resources that we have, and also give a reminder to individuals, as we all need. Sometimes, even though we are professionals and we do this all the time, we kind of forget to kind of take care of ourselves. So I just want to be a supportive colleague to everyone and make sure that I remind you about these things and some of the things to watch for. So we know that these are very, very challenging times for us. And so we do understand that stress and distressing emotions are heightened, and often heightened during times like this. With the weather-related events that have occurred, on top of the pandemic, we do expect that there is a lot of stress that is actually happening. But we do understand that acute stress during these types of times is not abnormal, right, and typical. We understand that these things will happen. But we also want to make sure that we're working to take care of ourselves and manage these emotions and manage them well. So a lot of times what we do know is that certain populations also are probably a little more vulnerable during these times. And so we want to make sure that we're paying attention to those populations. So older people, people who already have illness, people who may be predisposed to certain illnesses or to becoming more ill due to their current conditions, younger people, children. We want to make sure that we're taking those things into account. And as Ms. Stubbs said earlier, people who are likely having who have a history of substance abuse or substance use. So we want to make sure that we are paying attention to those things, so that if people do need our assistance, we can be there to help them. We also know that how one responds can depend on their background and the things that make them different from other people in the community that one may live in. So we want to make sure that we're paying attention and that we're being sensitive to those things, especially during these times where people are reacting and having specific reactions due to the ongoing pandemic and the weather-related events that are actually happening. So a couple of the things that I would definitely want to stress are a few things that I've talked about probably ad nauseum for a lot of people, but it's who I am, and I will keep saying it because I think that, you know, it could help us all. So the first thing I want to talk about is making sure that we keep the lines of communication open, not just with our colleagues or our family, but making sure that we help other people to keep those lines open with us too. Communication is vital. So we want to make sure that people understand that they can call us, but also that we are reaching out to people also. Another part about communication is we want to make sure that we dispel any rumors or any myths about things that are actually occurring. So for instance, I know that there are a lot of things that are ongoing about the pandemic and about what's actually occurring. If you know that these things aren't true, please say that's not true, because we want to make sure that we help people to feel more comfortable as we're all navigating through this time. We also want to make sure that we're communicating with those people who are more vulnerable during this time, especially those who may tend to be isolative or who we may notice that they're going into isolation states. Make sure that we stay on top of that. The next thing is related, and that's connectedness. So you want to stay connected to people. I know that it's difficult for a lot of people, and for some people, including certain introverts, it's probably very nice to not be as connected, right? But connectedness is still very, very important. We need to stay connected virtually, and make sure that we are practicing physical distancing, but making sure that we keep each other connected to each other and we stay connected to in some way. Related to that is support. Remember to support others, but also supporting yourself. And I know that sounds kind of silly, but it makes sense, right? We've all heard the adage that you can't help somebody if you can't help yourself. So you want to make sure that you're taking care of yourself and that you're supporting yourself. So finding things to do to uplift yourself, to congratulate yourself, to celebrate yourself. We had a challenge a couple of weeks ago from our assistant secretary that told us, even taking notice of the smaller things, things like how many tasks did you accomplish today? We often don't realize that we don't celebrate ourselves. And so when we're going through these very stressful times, we need to make sure that we're doing those things so that we can keep ourselves on track and uplifted. Safety is the next thing. Physical safety and emotional safety are very, very important. Clearly, we understand why physical safety is important, but emotional safety is very important also. Making sure that you are checking in with yourself and keeping yourself pretty balanced. And if not, that helps you to know that you need to reach out to someone. Limiting media intake. I know that that is a very weird thing to say, right? When we're saying keep in touch virtually. It's different though, right? Because I mean, I know IG is real cool and it's good and they have some great things on there, but there can also be a challenge to viewing too much media intake. Just as viewing too much news can be harmful, viewing too many other things that aren't positive and uplifting could be harmful also. So just make sure that you're taking into account the things that you are taking in. Um, some research suggests taking in only 2 to 3 um, news watching shows a day. So I know that may be hard for people, especially when things are on around the clock, but maybe make that a challenge for yourself. See how much you can do and how much you can do without. The next thing is routines. Stick to routines and develop new ones. This is a perfect time to start thinking about some new things that you can do, that you and your family can do. Routines provide structure and they often help you to manage your day appropriately and stay on task. Um, it also gives some people a semblance of normalcy during these types of times. And so overall health, just stay healthy physically and emotionally. And it's easier said than done. I know people talk about nutrition and diet, but maybe keep a food diary. Think about some of the things that you are eating and think about some ways that you can improve. Rest and relaxation. Now, I know I probably speak for a lot of us when I know the recommended 8 hours of sleep is a myth sometimes, but we can try, right? And so just making sure that you're getting enough rest, exercise, and staying active. That is one thing that a lot of people are talking about. So walking around, counting your steps, walking around your yard, walking the street, all while wearing your mask. Um, And one of the last things I want to talk about in terms of overall health is avoiding substance use and maintaining health appointments and treatment regimens as much as possible. We all know that we have to take care of ourselves, but we also understand that if we were seeking treatment or have had treatment, we need to make sure that we do what we can to keep those appointments so that we can maintain our health. So I want to go over a couple of things, as Ms. Stubbs said earlier, in terms of our resources. So on our website and the LDH website, we have posted a behavioral health immediate resources flyer. So as noted earlier, we had the Keeping Calm Through COVID line, which we have now rebranded and expanded to the Keep Calm line. That number is 1-866-310-7977. All calls confidential, 24 hours a day, 7 days a week. The next line that we have is our Office of Behavioral Health Recovery Outreach line. This line too, confidential, 24/7 and toll free. And we definitely want healthcare professionals and individuals in recovery to utilize this line. This is a line that will definitely be worthy of being used by those populations. That number is 1-833-333-1132. We also have a Via Link Cope line that we're promoting. It's 1-800-749-2673. And that is the ability to chat with a counselor between the hours of 3 and 10, Monday through Friday. The crisis text line that is being promoted from the governor's office for the Conquer COVID LA. You can text Reach Out, that is REACHOUT, all caps, to 741-741. And the final line that I want to talk about was just launched yesterday, and we were asked to share this information. This is a free crisis line, crisis counseling line that Magellan Health has launched, and they have asked that we spread the word and that anyone who wants to call can call toll free for a confidential consultation. And that number is 1-800-327-7451. Please reach out if you cannot find the information on our webpage, which is ldh.la.gov/obh. But feel free to reach out to any of us at any time and we'll connect you to the right information. So that's my time. Thank you.